Hi friends, welcome to classes by Lab Doctor. I am Dr. Divya and in today's class we will study about the RBC castes. So what are castes? Castes are nothing but these are the formed elements mainly formed in the distal convoluted tubules or the collecting duct, that is the loop of Henle. So there are different types of castes, like we divide them as acellular and cellular castes. We have seen in the previous classes about the hyaline caste, granular caste, waxy caste and fatty caste. Today we will concentrate on the cellular caste and especially the RBC caste. So the other cellular castes are the WBC caste and the epithelial cell caste. So this is an RBC caste. You can see the outline here of the caste and you can see the RBCs here. So RBCs caste, what are these? So these caste are formed when the red blood cells, they will stick together and they form the RBC caste. So when does the red blood cells are there in the nephrons in the first place? Whenever there is bleeding in the nephrons. It could be because of acute glomerulonephritis, or there is an infarction in the kidney, or there is an autoimmune disorder, there is a nephritic pathology. So that time these RBCs, they come together in the background of a matrix, in the background of a TAM phosphol protein matrix, and then they form this kind of a caste. So whenever you see RBC caste, you cannot neglect them. They are much more specific and they suggest that yes, there was a bleeding in the nephron. And especially when you see the RBC caste, you should remember they are mainly associated with the damage to the glomerulus. So glomerular damage is indicated by this RBC caste. So remember, this RBC caste is always pathological. There are very few conditions where you might see physiological conditions where you might see this RBC caste. So it is most of the time it suggests there is a bleeding inside the nephron, and it is most of the time pathological, and it always indicative of a glomerular damage. So what are the causes for it? It could be glomerulonephritis because of various causes, because of post-infectious causes or toxic causes, etc. Or it could be because of systemic lupus erythematosus, Goodpasture syndrome. There could be a renal infarction. There could be a subacute bacterial endocarditis. There could be nephritis. So these are the various other causes of RBC caste. Should also remember, whenever there is diabetes, diabetic nephropathy can also sometimes lead to this RBC caste, as well as renal vein thrombosis. If there is a severe pyelonephritis, then also there can be this RBC caste. So how does this caste appear? So usually what you see is these are colorless, or they are slightly have a brownish tinge, and they might only contain few RBCs. Sometimes these RBCs, what happens, they degenerate and they form the hemoglobin caste or the blood caste, and that time the color of the caste is brownish red or orangish in color. So that is the hemoglobin caste. So here you can see that these are the RBC cars. They are like, they look like a cylinder, clear cylinder, and they have this, RBCs, which you can see here. Sometimes they have an orangish red tinge, and I've told you that their presence indicate bleeding into the nephron. So when these RBCs within the cast, when they get hemolyzed, and that time the cast is known as hemoglobin cast, which have this orangish color and the homogeneous ground glass texture, because the RBCs are now all ruptured. So in order to call that as an RBC cast, the outline of the red cell must be clearly visible in one area at least. So to tell that okay, this is an RBC cast, I need RBCs on this matrix at least in one area. So we have to see the round outline of the RBCs at least in one area to call this cast as an RBC cast. So here also you can see the RBC cast. So these are the RBC casts. So here you can see the degenerating RBC cast in a special stain, that is SM stain. So here you can see various stages of this degenerating RBCs, and here the degenerating RBCs with the Hen's bodies, and here you can see the intact and the degenerating RBCs with the pigmented granular materials, what you can see. So this is an hemoglobin cast due to progressive destruction of the RBCs. So this again is a picture of a RBC cast. So here also you can see the cylindrical structure, and here you can see it is colorless, clear, and here these are the rounded structure which are the RBCs. So RBC casts are associated with glomerular damage, which I have already told you, and because in our previous lectures also we have seen that whenever there is a glomerular damage, you also get dysmorphic erythrocytes. So these are the dysmorphic erythrocytes, that is different shapes of the RBC. So they are also very characteristic of glomerular damage. So sometimes I've told you, in only few physiological conditions, like in very heavy or strenuous contact sports, or in very sometimes because of an heavy exercise or something like that, sometimes you might get a RBC cast in a normal individual, but otherwise it is most of the time pathological. So you can easily detect this RBC cast under the low power because it has that orangish red color tinge. They are mostly fragile, and there may be you also have to look at the background, because there will be freestanding RBCs also. There will be, when you do a urine test in the reagent strip, it will show positive reagent strip for blood. So all this has to be correlated to give it as an RBC cast. So this here you can see the RBC cast. You can see the RBCs also which are scattered in the background, and also correlate with the urine reagent test. So remember that this presence of red blood cells cast in the urine is always pathological. You cannot ignore it, and it strongly suggests that there could be a glomerular damage. Glomerular damage could be because of glomerulonephritis, or an infarction, or an autoimmune disease, etc. So always remember that it is pathological and associated with the nephritic syndromes. So that is all about the RBC cast. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.